everyone, welcome to the Currents of Public Health webinar series presented by the School of Public Health at Georgia State University. The goal of the series is to explore relevant public health topics with members of our community. Today's topic is making the most of an academic program and careers at CDC. My name is Jessica Pratt and I serve as the Practice and Career Coordinator in the School of Public Health, and I will moderate the conversation today. Our panelists are all alumni of the School of Public Health's Master of Public Health program and currently work at the Centers for Disease Control and Prevention. They are Brittani Carter, ORISE Fellow, Angie Guinn, Behavioral Scientist, Ugo Okeke, ORISE Fellow, Rahsaan Overton, Health Scientist, and Kayla Staley, ORISE Fellow. I'll start us off by providing a brief overview of some of the hiring mechanisms for working at CDC. If you have a question at any point during our conversation, please feel free to type it in the Q&A box and we'll try our best to answer it. Fellowships are a popular mechanism for getting your foot in the door at CDC. Some are administered directly by CDC and can be found directly on the CDC website. Others are administered by ORISE, the Oak Ridge Institute for Science and Education. While these positions may be paid, fellowships are considered a continuation of an educational experience and not employment. The annual stipend typically begins at the GS level 9, which in Atlanta is around $55,000 a year. Some offer an additional stipend for healthcare costs. ORISE fellows are available at HRSA, FDA, EPA, and other federal agencies. To be eligible for an ORISE fellowship as a student, you must be enrolled in an accredited degree program. And as a postgraduate, have received your degree within 5 years of the start date or have all requirements completed prior to the start date. The program is typically open to qualified U.S. citizens, foreign nationals who are eligible to participate as J1 exchange visitors, and foreign nationals eligible for other visa categories approved by CDC and ORISE. Contracting is another way to work for the CDC. The agency has agreements with a number of private companies to provide staff for a variety of public health positions. Employment as a contractor is available through these companies. As a contractor, you are categorized as an employee of a specific company that has a contract with CDC, rather than as a federal employee. Terms of employment and benefits are specified by the contractor, not the CDC. I want to share a little bit more about how the contracting companies function because I get a lot of questions about this. And when we talk with the panelists, I welcome any additional information. CDC puts out a bid for a scope of work and contracting companies respond to that bid by outlining how they will complete the work and provide a budget. Sometimes the contractor will post positions related to the scope of work before they are awarded the contract, which is sometimes why you may apply to a job that never seems to go anywhere. Finally, you may hear people refer to FTE or full-time equivalent, which means working full-time as a federal employee for CDC. FTE positions are ones that you would apply to through usajobs.gov, the government's job application system. It's pretty rare to be hired directly into an FTE these days, and most of our graduates are hired through fellowships and contracting agencies with the hopes of being hired as an FTE after a few years. Before we get started with asking the panelists our questions, I would like to poll our attendees. What best describes your interest in CDC opportunities? I'm a graduate in the program and looking for opportunities. I'm an undergraduate in a program. I'm in an undergraduate program and looking for opportunities. And I'm no longer in school and looking for CDC opportunities. I'll give you a moment to respond to that poll. Okay, great. So it looks like most folks are in the graduate program now and looking to learn more about CDC opportunities. We'll certainly keep this in mind as our panelists respond to the questions today. So I'd like to go ahead and go to our panelists, and I'll start with you, Brittani. Can you share with us what you think made you a competitive candidate for an ORISE fellowship?
Thanks, Jessica. For me, I think what made me competitive for a fellowship would be the experience that I gained in my graduate program. So for me, I made sure to be involved as much as possible. I was able to work as a graduate research assistant. I was able to serve on the Public Health Student Association, and I was able to network with a lot of different professors. So I think for me, that whole experience of not just going to school and then going home, which I know it may not be an option for a lot of people, but for me, I think I tried to make the most of my graduate program by being involved as many things as possible. And I also had the opportunity to work with a PhD student on his dissertation. So that also gave me the opportunity to be extremely involved. And I would also say my practicum was a very great experience because my mentor during my practicum, he was very helpful in navigating like different spaces, giving me a lot of opportunities. So I would say, in addition to doing well in school, was the extracurricular activities that I was involved in that made me a very strong candidate for my ORISE fellowship.
Great, thank you. And Ugo, can you share what the application and interview process was like for the ORISE fellowship?
Thank you, Jessica. I would definitely say the application process was pretty fluid. Like you just showed, just logging into Z Intellect, that's where a lot of the applications are that I've seen are housed. And so in doing so, just kind of doing everything online, just making sure my resume was up to date, things of that nature. I had credible references that I could use in the application as well. And ORISE HR, I'm assuming employee, reached out to me, which felt like maybe a preliminary interview just to see if I was still interested. Just making sure that the qualifications I had were accurate as it reflected on my resume. And so then she proceeded to tell me that there were, the next steps were a member from the division would contact me in order to schedule another interview, which would be with the employee and the supervisor and another team member as well. And so eventually it turned into, or was going to be, a group interview. And so I would kind of associate it to maybe 2 stages of interviewing with the ORISE and then with the division that's requesting that position to be filled with an ORISE candidate.
Okay, and as a follow-up, do you recall the amount of time that passed between when you applied for the opportunity and when you were called for an interview and actually brought on board? Was that a quick process or did it take a long time?
At first it was pretty difficult to find which job I applied to, just because I applied to so many. But just going back, I think it was about 3 weeks. It was a good 3 weeks. And one thing about Intellect, they'll tell you the deadline or when the application closes. And I use that to kind of gear towards when I might, receive some type of notification, because a lot of times you might not receive any notification. And so a lot of people get hung up on that. And so because they have that deadline, I sort of use that onto, like, if they're going to close the deadline at a certain time, I'm assuming that maybe within a week or so, or maybe 2 weeks, they'll reach out to somebody else.
Okay, and one of the questions that came in the Q&A box, what kind of references, either Brittany or Ugo can answer this question, who did you use as references for your application?
For my application, I definitely used a CDC employee. I think that that's very advantageous, of course, to see that you already have a network or a connection inside the CDC. And then I also used a professor from Georgia State University as well, just so that they can back up all my experience and knowledge in the public health field. So I just kind of took my background and used that to my advantage on the references that I used.
Yeah, similar to what Ugo mentioned, I also reached out to professors, and I also tailored my references to the position that I was applying for. So for me, my focus was in HIV prevention. So a lot of the people who I received references from were people who specialize in the HIV prevention. So like they can kind of attest to my skills because they've already seen the work that I've done, and they're very well known in the field as well. So I think that was very advantageous to me, as well as to have people who are very well known in the public health field and very well known in the HIV prevention field to also provide a reference for me as well. But I would say that when seeking to asking people for references, I think it's also important to make sure that it's someone who actually can judge and serve as a basis for judgment, because I know, you may want to use your friend, something like that, but I think it's important to be able to give someone who can actually attest to your skills and your capabilities, because they are going to ask questions, because I've written references before. So like they've asked questions about like, how long have you known this person, and like, how can you, you know, attest to like their competencies and their abilities. So I think it's important to make sure that you're choosing your references wisely. And if you need to, you can provide them with your resume or with anything that you want them to highlight also in your reference as well.
Yes, I will definitely echo that if you ask someone to be a reference, they will very much appreciate it if you can provide your resume, the job description, and then any information that you want to highlight about why you are qualified for that position. It really helps them to write a really strong reference letter for you, and that's definitely what you want. So I'm going to hop on over to Kayla, who is also an ORISE fellow, and ask her if she can share a little bit more about what some of the advantages and some of the disadvantages of doing an ORISE fellowship.
Yeah, thank you for the question, Jessica. For me, the advantages far outweigh the disadvantages, but I'll start with the disadvantages. Some of the disadvantages or cons that I've found with fellowships are that, and Ugo touched on this, the onboarding period to actually begin working was much longer than I anticipated. It could be weeks, or I've heard of situations where it was months potentially, from hearing back from when you submitted your application to the initial interview. And even after you've been offered employment, it can take a while for the background to clear and all of the other crucial steps involved before you can actually, you know, step onto campus and move around freely as a standard employee would. Another disadvantage, I believe, is the frequency of pay for me and the taxes situation. I am coming up on my 1 year mark, so I'm just now navigating the taxes process for the first time. But taxes do not come out of your check. You ideally would pay on them quarterly. That's the smarter option, or a larger lump sum around April. And with that, we get paid once a month. So for me, that's not, it took some time for me to figure out that balance on how to budget one check to last the entire month. And further, I would say, Jessica mentioned this earlier, but fellows start off as a equivalent GS9, which is just about $55,000 a year before taxes. So definitely decent money, but you know, we all want more, right? The last disadvantage I would include is that there isn't a clear or, you know, direct pathway to becoming FTE. Most fellows' goal is to become an FTE. For some, it may take 3 to 4 years of being a fellow, and others, some on this panel, you know, they were able to make that transition from ORISE fellow to FTE in a shorter time frame. But there is no, you know, guarantee that you will be offered or end up becoming an FTE at the end of your fellowship. And, you know, I'm still navigating that workplace ladder, you know, just trying to figure that out. But on to the positives. Things that I love about being a fellow are the opportunity to get to experience, the opportunity to get experience in the public health field without feeling like I can break anything. That's something my mentor / supervisor, I use those interchangeably, stresses to the fellows on my team a lot. As a fellow, you are technically not an employee of CDC directly, so you can't individually be responsible for anything major, which is nice because it just kind of allows room for a certain level of freedom and the ability to learn on hand without being afraid to like make a mistake. I know my mentor specifically is super supportive of innovative ways to make our work better and easier. So as a new person on the team and as a fellow, it allows me the opportunity to contribute to the team in a real way. And it makes me feel like a valuable team member, like I'm contributing. One of the things that I've been working with my mentor on recently is the implementation of diversity and inclusion meetings within our team, like completely separate from our workplace duties. And, you know, I would be remiss if I didn't use this small platform as a panelist that I have to touch on or to highlight the injustices kind of plaguing the Black community in our society currently. Most recently being the shooting of Jacob Blake in Kenosha County, Wisconsin. I definitely encourage all students and faculty to use their voices, no matter what race, to invoke the change that we all want and need to see in our country, whatever that means to you, whether it's on campus, virtually, in the workplace, or in your own community. Moving on to other advantages. I love that we're able to travel pre-COVID to conferences and present our work at nationally renowned and recognized conferences. It really gives me that chance to stretch that presentation skills muscle and really be proud of and show some of the work that we've been working on, and ORISE pays for that. So that's super special and advantageous. A few more, it allows me to learn and work alongside other young professionals in our field. There's a fellows collective within CDC, so fellows from all campuses are able to participate in several different committees, and it's been a huge network for support during my first year as a fellow. And lastly, I would just end with job security and health insurance. These are really big advantages for me. As a fellow, we are required to either have our own health insurance or accept the health insurance offered by ORISE. I'm 27, so no longer on my mother's health insurance. So that was a huge bonus for me, and not a luxury that all working people are afforded in this country. Additionally, most fellowships, as you said earlier, are at least a year-long commitment and can be renewed at the discretion of your mentor, supervisor, and yourself if you choose to renew. To me, that's a huge advantage because, during this time, this goes without saying, like, job security is a huge thing going on right now. The job market has not been the best. So I've been fortunate enough to be able to continue working from home and to continue to be paid. So those are definitely some of the disadvantages and advantages for me of fellowships.
Thank you, Kayla, and thank you for your comments about the current racial injustices that we're seeing and experiencing. And as public health professionals, we all know that very strong link to the health impacts that people are experiencing, and definitely want to share that the School of Public Health is involved in some initiatives here at Georgia State to try to raise the profile of those issues and raise the research focus on that. So I believe you can find some more information on our website about those efforts that the School of Public Health has undertaken. So that was awesome information about the ORISE fellowships, and I know we have a couple more questions that have come in from the audience, and we'll get back to those. I did just want to switch for a moment on to some of the other employment categories and ask you, Angie, if you will talk a little bit about how you became a CDC employee.
Sure, thank you, Jessica. So I definitely went down the path of networking. So as I was a GRE at the School of Public Health, and through that I was able to access a practicum within the Division of Violence Prevention at CDC. And so while I was there, I was able to network, meet with people, have informational interviews. And with that led to an ORISE fellowship. Really wasn't traditional in the way that it was posted on Zintellect and applications. It was more of a hands-on, you see my skills every day, networking, seeing the opportunities that may or may not become available. What a lot of people don't know is a lot of ORISE fellowships don't actually get published. And it's kind of a last minute if money's available, and it's through networks and people like Jessica who reach out, hey, do you have a recent graduate that you know, or do you have someone that might be able to be a candidate for this? And so that is word of mouth is quickly to be able to have someone fill that position. So I became an ORISE fellow and was an ORISE fellow for a little while. And within that, again, just talking to people, applying for everything. I know Ugo had just said he could remember which ORISE fellowship called him back because he applied for so many. And that's really what you have to do, is just any opportunity that you see, because sooner or later luck will meet opportunity and you'll be able to secure a position. And so through that, I was able to become a contractor just by always searching job boards and seeing and talking to people to see what's available. And then I was a contractor for a year. Again, still in my contracting position, my end goal was to become a full-time employee. So even though I was one step closer to becoming a full-time employee, I never stopped looking for opportunities and looking for things to be in my end goal. And so talking with people, building those skills, it's really important to what I call reverse resume, is look at these job postings. What are the skills that are needed? Yes, it'll say education, an MPH or PhD, but you can look past that. Like, what is the actual skills that's needed for this job, and how can I secure that? And especially students who are still in school or just graduated, bonding those relationships with professors and people who have those skills is really important, because you're in a great environment to develop those skills. And so I think my journey was around 4 years, but I'm almost going into 9 months of my position as a behavioral scientist.
Thank you, Angie. I think you answered one of the questions that just came in your response about transitioning from a fellow to being hired as an FTE. And I guess if you could speak a little bit more about how being a contractor differs from being an FTE or from being a fellow. Can you speak a little bit more about that contracting function?
Yeah, for sure. So as Kayla had mentioned, in an ORISE fellowship, you're really not employed by the CDC. It's considered a scholarship, and it's a considered continuing education within the federal government. A contracting position is you're actually employed by an employer. Your employer, whether that be a large contracting agency or a small minority-owned contracting agency, you have an employer. And when you have an employer, your roles and responsibilities are to your employer. Now, you may be on campus and you may not see your employer for months on end, but you're working for the contracting agency, and you're working at a specific statement of work on why you're there. So the difference is yes, you have all the benefits that come to being a full-time employee with any employer, retirement benefits, health insurance, things of that nature. But the difference between an ORISE fellowship and a contractor is that you have a specific duty and you have a specific job, and that is to make the client happy, and your client is CDC. So if you're looking at it that way, being punctual, being professional, knowing that the people that you work with may not be your actual fellow employees. Usually you're working with full-time employees of the CDC. And so knowing that distinction, that even though you may feel like you're with CDC and working at CDC physically and working with people who work at CDC, you're actually there to provide them a service and provide a product for them. And actually, it's a really good way to say, yes, I'm in charge of a project. The difference between a fellowship is you're in charge of a project, your statement of work. And it's really important to show them that, hey, I'm capable of doing this, because it looks really good when you start applying to these FTEs that I was in charge of a project and I saw it from start to finish, sorry.
Okay. Right. Yeah, thank you. And Angie, or Rahsaan can hop in here because I know you've had some experience with this too, but is it correct that, let's say that statement of work or that contract, let's, for example, say it was 2 years, and so you might be working on that project for 2 years, and that contract gets bid again, and let's say the company that you work for gets it again, and you might seamlessly work on it for another 2 years, or maybe a different company gets it, and if that happens, you might go to the new company that gets it and continue the work under a different contractor, or you could potentially stay with the original contractor and maybe begin working on a different contract. Is that correct?
Yeah, that's correct. So usually,
Okay.
most likely, if a new contractor gets a bid and your old contracting agency doesn't, you'll get quote unquote let go. And then the new contracting agency will pick you up, right? Because you have someone who's been in experience, been doing this work. It makes sense for the new contract agency to not really repost it, go through the whole job process of hiring again. They'll just rehire you. Some of these larger contracting agencies, if they don't get another bid, they'll put you on a new project. So you have a little bit more job security than some of these smaller contracting agencies. And that's kind of how some contracting agencies are competitive against each other is, hey, I can guarantee you job security. You just may not be on the same project from year to year.
Sounds a little bit complicated. Thank
Yeah,
you, Angie.
it is.
And so, Rahsaan, I wanted to come to you next. Can you talk a little bit about your journey in terms of your application and interview process for your position?
Yes, mine was a little different. I was recruited into a contractor. A contractor recruited me into the job. So if you know your LinkedIn profile, Indeed, there are a lot of recruiters on there, and now you can make it your profile public. And if they like your skills, then they'll contact you, and then they'll set up a series of kind of phone calls and interviews to see because they have a list of jobs that they're recruiting for. So they'll run them across you and see what you like. And if you pick one that you're interested in, they'll, forward your information to CDC, the division who's hiring, the hiring manager. And if they like you, then they'll bring you in for an interview. And so that's how I got in at CDC. I was recruited in through a recruiter, and then I had really just interviews and with the team, and I was offered the job. I came into CDC at a very interesting time, December 2019. So with COVID, I say that because I became an FTE within 7 months, which is like unheard of. But because there's a flood of funding and need for positions and bodies, I used what everybody here said, my networking skills and the people who I've met in my previous jobs, as well as the 7 months I was at as a contractor and the people that I met. I was set up for that position, really. I met the hiring manager. He was looking for people who to build his team out, and so we talked, and I was a great fit for his team, and I went through the whole USA Jobs to apply for the job, and I received the job as an FTE. So a little bit different, but there's so many different avenues to get into CDC via ORISE fellowships, contractors, FTEs, and there are even some other routes that people have taken. So.
Okay, great. One of the questions that came in while you were talking that maybe you can speak a little to about is whether or not you felt like your degree kind of gave you that boost to be hired as an FTE.
Yes.
Or can only an MPH get an FTE?
No, I mean, CDC is full of people with different backgrounds. I mean, they're a company. So there's people with business backgrounds. There's people with, obviously we do public health, so MPH are going to be the vast majority of the people who work there. But I work in my division, I work with a lot of MDs. There's nurses, there's infection preventionists. There's people who have, health administration backgrounds and actually, a lot of veterinary medicine doctors are at CDC because of the, animal host of diseases that are found in animals that jump to humans. And so there's a variety of backgrounds. It really just depends on the position. I mean, whatever CDC is looking for, they're going to post that job, and whatever qualifications they need for that position is what it is. So you don't need an MPH to get into CDC.
Right. And so kind of sticking with that theme, some questions around, do you need a master's degree? Does it need to be in public health? It sounds like what you're saying is that CDC employs people from a lot of different backgrounds, but probably, to advance, having that master's degree is going to be important. Is that right?
Of course, yes. It's going to be important to stay competitive in the job field that we're in now. It used to be just a bachelor's degree could get you a lot, pretty far. But now, if everybody has a master's degree, you're going to need a master's degree to be competitive in the job field. So.
Yeah. This is another great question that came in the Q&A. Were any of you offered the fellowship before you graduated with your degree?
I was.
Yeah, same. Well, in a way. So for me, I applied April before I graduated. So that was the fellowship that I received. So at that time, I only had a bachelor's degree when I applied. But then once you go through the process of getting your degree conferred and all that type of stuff, then you update ORISE, let them know hi, now I have a master's degree. So initially, when I applied for all the fellowship that I applied for, I was still in grad school applying. And then of course, once I graduated, I was able to then update and let them know that I had already obtained my master's degree. But you can definitely, because there are some fellowships that allow you to only have a bachelor's degree. I'm sorry. So they only allow you to have a bachelor's degree. So those are, there's different options. You can have a bachelor's degree, and then there's some that require your master's degree. But for me, when I applied, I only had a bachelor's degree.
Yeah, and I'll just echo Brittani that my fellowship was offered to me while I was an intern. And so we waited until I received my master's degree to go through with the paperwork in that process. But I was networking and working and trying to secure something permanent at something like a ORISE fellowship within my division that I was interning at.
I had a follow-up question about the ORISE fellowships. I think it was, yes, it came in through the Q&A. If you can talk, maybe some of the folks who have come in through that process more recently, the question has to do with the rolling application process for ORISE. It says, my understanding is that there are sometimes fellowships announced that aren't actually open, but they post the announcement on a rolling basis. Have any of you all experienced that, or can you speak to that?
Yeah, unfortunately, sometimes, I guess just because they're delayed or behind, there are some positions sometimes that are posted on there that have already been filled. So I know one time my position was still on there and I had already started my fellowship. So it's there are people who probably continue to apply to those positions, but they haven't been taken down just yet, which is unfortunate. And I know sometimes when I talk to people about a fellowship, I recommend that if the posting is probably over a year or something like that, then I wouldn't apply, because more than likely it's already been filled by someone. They just haven't had the chance to take it off the website, it's hard to know which ones have already been filled and all that kind of stuff. But that definitely is an unfortunate option, that sometimes they're not really open because that position has already been filled, or they're going through the process of getting the person, on board and everything like that. But yeah, that's just my experience, because I have witnessed that and I've saw it myself as well.
I will say that employers or some people that are looking for ORISE fellows they go through a third party to put that post on Scintillect. So they really don't have any control of when it goes up, when it gets taken down. And also, I will say that depending on what kind of center or division that you're in, sometimes they'll post a blanket post and they'll hire a couple fellows off of that posting. So that's another thing to think about.
And Angie, as you were talking, I thought of something else that has come up in the past, and a couple of you touched on it when talking about your interview and hiring process, that the time frame for these things varies a lot. So potentially getting an offer from a contracting agency, you might be expected to start working pretty quickly versus ORISE and an FTE position. Can anybody kind of share about that? Like maybe Rahsaan, you could speak to when you had started being in contact with the recruiter, that time frame. I don't remember if you talked about that.
Yes. So, I mean, I was picky, and I suggest most people be picky in the jobs that they pick. So I talked to the recruiter for several months before I settled on a position that was, that the position that something that I wanted to do and was going to benefit me in my career, as well as also, pay me what I felt I deserved. So a couple of months, but once the balls start rolling, contractors can actually onboard you pretty quickly. So, I gave a standard 2-week, I think I might have given like maybe a 3-week notice, but, standard 2-week notice should suffice in most cases. Now the government, is that becoming an FTE is a totally different process. Like before COVID, that process was several months. But now they're trying to speed up just to onboard people, so through the pipeline. But so the two different processes. The government tends to be a little bit slower as becoming an FTE versus a contractor can onboard you pretty quickly. It also say real quick, sorry. It also depends on background check, because as a CDC, you have to go through your background check and reference checks and all that. So depending on how fast all of that is processed, will also depend on when you get a start date or when you can start.
Brittany, were you going to add something?
Oh, well, yeah, I just wanted to add about my experience in regards to the waiting process, because initially when I first applied, I kind of forgot about some of the ones that I've applied to, because as Ugo mentioned, I applied to a lot of fellowships. So I applied to my first fellowship in April, and I didn't hear anything back until June. And then at that point, I was like, well, I guess maybe it didn't work out. But that's just because, to me, I wasn't aware of how long the process would take. And then once I had heard back from them in June, I had my interview, and then I started in August. So essentially from April to August was the time frame from me applying to me starting. So that's just my experience and my, how my trajectory, but I think it can be different for a lot of different people. When I got my second fellowship, because I was already in CDC, I think it was able to go very, I think it only took maybe 3 weeks. I had my interview, and I think maybe 3 weeks later, I had already got confirmation that I received the fellowship. So I think it just really depends on where your division is housed. I think it's just a lot of different factors that go into when you're starting. But I think if you don't hear back within the first 3 weeks or whatever like that, I wouldn't get too worried, because I just naturally things just take a long time. Because I know personally, my team, they go through all the applications, and they intensely mark, they have a rubric to decide oh, this person has this skill. So they go, it's a very in-depth process that they do with these resumes. So depending on how many people apply for the position, it can take a good bit of time for them to reach out to you for an interview. So I wouldn't let that deter anyone from, just because you haven't heard back in maybe 2-3 weeks or a month, I wouldn't let that deter you from continue to apply or thinking that position isn't for you.
Thank you, Brittany. And this question came in too, which I think is a good kind of bridge for us. Someone asked, what are your suggestions on how to network in light of this pandemic? So many of you have talked about your networking efforts that helped you be successful in finding employment with CDC or in fellowship. So do any of y'all have advice for the folks on the call for how to network given our new reality?
Thank you, Jess, for asking that. I recently typed up an answer for whoever asked that question. But what I was saying in the response was just things like this, this webinar, for instance, use this to your advantage. You have all of our names on here, so you can go on LinkedIn, which would be my next suggestion. Go on LinkedIn, add us on LinkedIn, reach out to us and see how we can assist you in helping you build that network. And right then you're building a network. And so just little things like that. I know it's pretty difficult in times like this, but again, we kind of have to make do with what we have. And so things like the LinkedIn, different webinars, reaching out to GSU, public health organization and things like that. So that's what I would do.
Yeah, I'd piggyback on that. When I was at Georgia State, I had actually several professors who worked at CDC. So I kept their contact information and kept in contact with them after post-graduation, just about jobs in my career and what I had in mind for my next steps. Also, take advantage of being so close to DPH down there. DPH does a lot with CDC, and that experience there, paid or unpaid, is can be very, very valuable. The people you meet, as well as the stuff that you're doing at the Department of Public Health, or even like at the county level, can be very valuable and boost your resume if you're looking to join CDC.
Yeah, I just wanted to kind of piggyback on what they both mentioned. Use like LinkedIn to your advantage for sure. Like even if you've never had any type of interaction with the person, if you're looking to, like, I guess, network or to even just gain additional skills in something that someone else maybe, someone else already has that skills in, like just send a quick email, a quick message to them, maybe asking for an informational interview just to kind of have like that conversation. And I think a lot of times for people who aren't as like, what's the word? If you don't feel like confident, like speaking to people, like this is the perfect time to just talk to them over the phone. Like you don't have to worry about meeting people in person, because I know sometimes that can be awkward and all that kind of stuff. But I definitely would recommend like using LinkedIn to your advantage, because people like to talk about themselves a lot. So, and I think that's important, especially in public health, because it's great to know like what you know, but it's also great to know who you know. So you'll never know who knows someone who works in the division that you're trying to get into, or any type of thing like that. I think it's important to make the most of this time right now to reach out to as many people as possible, just to understand how they got from point A to point B, or what their next steps are, or if there's any tips or tricks, stuff like that, they can give you. I think it's important to use LinkedIn to your advantage. If you don't have a LinkedIn already, I highly recommend it. I'm pretty sure Jessica probably already recommended everybody to have one. So yeah, I definitely would use LinkedIn to my advantage to reach out to people who are working at CDC and see that they'll be able just to give like a brief 30-minute phone conversation just to ask about the work that they do and how do they get to that point, and stuff like that.
And I just wanted to add on to that, and we're mentioning LinkedIn a lot. Just make sure that your LinkedIn is up to date and it is appropriate for whoever you're reaching out to. Because a lot of times, I'll get somebody that has a LinkedIn and they'll reach out to me but has nothing in their LinkedIn, like no experience, no job, no education. And I'm sure they have a resume, saved in their laptop that has everything. But just if you're going to reach out on your LinkedIn and that's the first thing that someone's going to see, just make sure it's up to date, it's clean, it looks fresh, things like that.
Yeah, and I also just want to kind of reiterate what Brittany was saying. Like, don't be afraid to reach out to people, especially young professionals. Like, most times people are happy to help. And Brittany actually spoke at my graduation, and and I was a little intimidated at first to go up and speak to her, but she was so integral when I was in the application process, as well as like an encouraging sounding board, waiting to hear back for weeks and weeks, as we've already, discussed. So definitely, don't be afraid, put yourself out there, talk to people. Everybody wants to be of help, I would say.
That's awesome, Kayla. Thank you for sharing that. And just to expand a little bit more on that, on the LinkedIn and making sure that you have a complete profile and a professional picture. Those of you who are still students at Georgia State have the option of working with the Career Center to get a professional photo. And I'll need to double check that now that COVID is here. I'll let you know if that's still an option, an offering from them. But if you're applying for something or if you're asking someone for help, they're going to do a little bit of background research on you. So making sure that you have that looking professional. And the same goes the other way. If you're asking someone to do a professional or an informational interview, making sure you do your research so that you have some really thoughtful questions to ask them that are specific to the work you see that they're doing. So would definitely recommend doing that research ahead of time. One of the questions, this is sort of similar to the networking, the questions that came in was there a specific course or instructor in your program that you found particularly helpful? Either it, gave you a specific skill or you were able to establish a relationship with someone who was pivotal.
Yeah, Jessica, I answered that in the chat, and for me, it definitely was. And I think it's definitely important, whatever your interests are, that you create a great relationship with a faculty who have similar interests, whether that be just around, if you have interests around data analytics and statistics, then of course the biostatistics department and the faculty there are going to be beneficial for you. If you're someone like me who was very interested in child abuse and neglect research and around violence prevention, the Mark Chaffin Center for Healthy Development was essential to where I am now. And that's because they helped me to get to where I am today. And that's because of the similar interests. There's amazing faculty at GSU that have worked at CDC and that have decided to work in academics, and that's because they want to help students. And so it's really important to go to their office hours, ask questions, ask them for opportunities, that you never know when they're going to think of your name when an opportunity does come across their desk for a student. So it's really important to really build that relationship. They have amazing knowledge within their respective fields, and it would only benefit you to have a great relationship with them. And I'm sure everyone here can say the same thing.
Yeah, I would say the faculty is a great place to start. I mean, I did before, I think my first semester there, I was cold emailing professors to, put my foot in the door for, any kind of projects they needed help on. And like that, and then like, just to piggyback off of Angie, like then you're going to be the first name they think of when stuff comes across their desk. Because, this is like, Atlanta is the public health mecca. So everybody is doing everything with everybody. So, Georgia State professors are doing stuff with Emory, who is doing stuff with CDC and all over. So yeah, definitely, that's a good place to start is at Georgia State.
And sorry.
No, Kayla, go.
Okay, I was just gonna say for me, it was my practicum. I feel like practicums can kind of be seen as like this requirement that you have to do before you like get out the door, but really take the time to, invest in a practicum that interests you. I was able to work with some like food justice and stuff with that, and that kind of led me into the foodborne world. So that was really important for me, not necessarily a person or a skill, but really kind of exploring different interests that I had and investing in that. And that kind of led me to where I'm at now in CDC.
I just wanted to mention that I think sometimes it's difficult to actualize the networking. You know, networking is important. So these examples of what you all did specifically have been so helpful. And I will say that I have continued talking with these graduates of our program since they've left. And so it's definitely a two-way street that in order for your faculty and for folks like me and Gina that you interact with in OAA, in order for us to remember you, we need to hear from you, to hear what you're doing. If you'll share your successes with us, you can share your struggles with us, so that, again, we do think of you when those opportunities come our way. And we know that, you know, Angie has now, you know, moved into this position and she's working on child abuse. And, you know, I remember talking with Rahsaan about his career and path, and just him keeping me updated on what he was doing and not necessarily, you know, asking for things, but just making sure that I knew what he was working on, and always being willing to help connect other people. I think that's the piece of networking we forget, is that sometimes we're going to be the one who can actually help make that connection for someone. So just trying to talk to people and establish those relationships is so important. And as we're nearing the end of our time, I want to just put it back one more time to our panelists to say, you know, if you had one piece of advice, I would maybe outside of the networking, because we know that's going to be number one. But if you have any other pieces of advice for either soon to be graduates or folks that are already maybe in the field but are really looking to find something at CDC, any tidbits that you could offer in this final phase of our webinar? Angie, you want to go first?
Yeah, I would say for me is building your skill base. Find out what you want to do, and if you don't know what you want to do, have informational interviews with everyone. Ask people questions. What do you do at the CDC? You're going to get a wide variety of responses because there's so many different job paths that you can take at CDC. And to figure out what exactly you want, it's best to talk to everyone. I wouldn't focus so much on getting certificates and getting high-level degrees. I would focus more on relationships, building skills, showing on your resume that you can do something. Find a project that you can do start to finish, that you can actually put on your resume. You know, it's different between having experience and just being able to go through so many interviews. So I definitely would just build your skill level, have relationships with your professors if you're currently in school or outside of school, to just keep on building the skill levels and the skills that you need to get the position that you want.
I just piggyback on that. Don't close any doors. CDC is not the end. I mean, it might be the end result, but like you might not get there right now. Like, don't forget about all these other public health agencies, nonprofits, profits that have great jobs and actually do a lot with CDC. And then, you know, maybe in a couple years, you now have the skills to jump into CDC at a much higher level. So don't forget about that. That was my journey. I worked at 3 other different employers before I made it into CDC, but the timing was perfect. So don't forget about, you know, other public health companies and organizations that are doing great work that you could be interested in, that could just get to, you know, CDC if that's what you really want.
For me, I would just say, you know, be a sponge. This is more so for the recent graduates, but, you know, just being open, being a sponge. I feel like I graduated last year and I was like, all right, I mastered it. You know, I know what I'm doing, but now that I'm on the job, I'm learning more and more that I have lots to learn still. So just being open to that, being willing to learn and getting as much experience as possible.
My advice would be to as much as possible, keep your resume as up to date as you can. I heard from one person, I know it sounds really weird, but to update your resume every Friday. That sounds like a lot, but oftentimes when you're gaining experience, you're not gonna, if you wait to the end 3 months to update your resume, you're gonna forget a lot of the skills that you've gained in that time frame. If it works for you to update it every Friday, that's great, but I think it's important to always keep your resume as updated as possible. And don't underplay your experience. I think sometimes you'll be like, oh, I just was a research assistant. Or were you really though? Like, were you just a research assistant? You know, like sometimes you have to fluff up, you know, your skills. Of course, don't lie, but, you know, don't undermine, like, you know, and don't underplay, like, you know, don't downplay, you know, the skills that you actually have gained. I think it's important for you to tailor your resume as much as possible to each position. But of course, I think my take home message would be to make sure that your resume is up to date as much as possible at any moment.
Thank you.
And then for me, I guess there's just throughout my journey with CDC and even before, one quote that I like to use is delay is not denial. And so that can be used in kind of any perspective of the CDC, whether you're applying already in the CDC, in ORISE, and trying to take that next step. It will take time. Definitely with the speed of the government and things like that, there will be a whole bunch of delays and things like that. But don't let that hinder you. Don't let that be the end. And so don't let that delay be a denial. But in saying that, applying to all these places, that little denial that you'll get is just a minor delay for the end goal. Because like we said, I've applied to so many, you know, CDC ORISE jobs and things like that. And although I was denied, for me, that was just a minor delay to the end goal. So that's my piece of advice for everyone.
That's wonderful. Thank you, Ugo. And thank you to all of our panelists. And thank you for attending this Currents of Public Health webinar. It's been so helpful to hear about how working at the CDC actually works. Please save the date for our next webinar on Thursday, September 24th at 12 p.m., featuring Dr. Heather Bradley, faculty in the School of Public Health at Georgia State. And the topic will be the role of SARS-CoV-2 serostudies for monitoring burden of disease and associated risk factors. And in closing, the School of Public Health at Georgia State University is one of the most diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, a graduate certificate, a Master of Public Health degree in 5 concentrations, a PhD in 4 public health areas of knowledge, and a Doctor of Public Health, DRPH. The faculty and students conduct cutting-edge research on the complex 21st century public health challenges facing cities across the globe. Our work is often carried out in partnership with communities, their residents, and community-based organizations committed to health equity. If you would like more information about our programs or how to support the work of the school and our students, please visit publichealth.gsu.edu. Thank you again for attending, and please join us for our next webinar.